So today we are going to discuss some myths regarding scleral lenses which are more common in India, and to address them in more better way, I'm going to invite the amazing Dr. Daddi Fadel, someone I deeply admire and who is known worldwide in the field of scleral lens for expertise. So let's get started and bust some myths together. Okay, so I'm going to start by saying that I'm so excited to do a video collab with you, ma'am. So, Vilgar, I'll just say thank you so much for accepting this small request. And it's going to help a lot of patients, specifically in India, who are wearing scleral lenses. So, thank you so much, ma'am, and welcome to my video.
Thank you for involving me. It's such a pleasure to be part of this initiative, especially when it's going to patients. So if we can help patients not only in fitting them, but educating them, it's fantastic. Thank you for doing this.
All pleasure mine. So, ma'am, before we start, I was planning that can you just briefly explain what are the scleral lenses? Because sometimes it is really a game changer in many of the cases.
So yeah, you are talking about game changers. So why scleral lenses? We've been fitting soft contact lenses, but we know that soft contact lenses conform to the corneal shape, so they are not adequate to correct irregularities, especially advanced irregularities. We have corneal lenses that are very good option because they are rigid lenses, but they are small in diameter, and in advanced cases, the fitting may not be optimal, so patients can drop out of these lenses. And just because they are small, they are not indicated in cases like ocular surface diseases and dry eye patients. Scleral lenses are a game changer because they are a solution when we have problems with other lenses, and there is no other option than keratoplasty. So we have these lenses that have dropped down the number of keratoplasty because we are resolving so many cases. What are these scleral lenses? They are rigid contact lenses, large diameter, so they don't touch the cornea, neither the limbus. They touch only the conjunctiva, which is less sensitive than the cornea. The large diameter, and just because they are touching the conjunctiva, provide more comfort. The large diameter because of the less interaction with the eyelids compared to the corneal lenses, which each blinking, the eyelids are interacting with the edge of the corneal lenses, small diameter. This caused discomfort. Scleral lenses, just because they are larger, they don't have this issue. Just because also they are large diameter, they have more space between the cornea and the lens, and this space is filled with fluid, with saline. This saline is moistening the ocular surface. That's why they are indicated also in ocular surface disease and dry eye. And this fluid reservoir is correcting the irregularities. So they are not only indicated in challenging cases, but also in astigmatism or high myopia. Just because the lens is very stable on the eye, it doesn't move as corneal lenses. We can add astigmatism to the lens, and the lens is stable, vision is stable. We can add also multifocal, so they are indicated also in presbyopic patients. So we have so many indications for scleral lenses. The main indication, of course, keratoconus and corneal irregularities and ocular surface diseases, but so many indications for these lenses. They are amazing, yes.
Yes, ma'am. I totally agree with you, ma'am. And I remember during my fellowship days, we used to call this as a magic lens. That with any of the lenses, the vision is not improving, the patient is not comfortable. Just fit a scleral lens and they will read straight away the best possible visual acuity. So we used to call this as a magic lens. So so I was going to start with the first myth, which is more common in India, is like these lenses, like patient tells me that this is not for me. This is someone who is suffering from very advanced cases or someone very severe condition. I am just a normal patient. I don't have this high power, high irregularity. So this is more common, like how to address such, situations.
So you don't know if you are a candidate or not if you don't try them. As I was saying in the beginning, the main indication, yes, is irregularities and advanced ocular surface disease, but we have so many indications. You probably don't know about them.
Yeah.
If you have some problem or some symptoms, you are not 100% happy with contact lenses or with your spectacles, you can try with Scleral lenses. You may not like them, but you may like them. So you cannot say that you are not a candidate before trying them.
A trial is required before you judge or come to any conclusion.
Yes, absolutely. Yeah.
I totally agree with you.
It's like tasting is like tasting something. You cannot say I don't like it if you don't taste it. You don't know.
Yeah. So a trial and proper trial is important. Yes. So following that, like here in India, we see a lot of patients suffering from keratoconus or any actinic condition. And the most common question which I have been asked by the parents of the patient, that will it cure the condition? Like they might have come across C3R or some other techniques which holds the progression. But when we introduce Scleral lenses, they ask me that will it, stop the condition or will it bring the condition back to the normal? So this is
No.
Yeah.
No, they are not a healing. They don't treat.
Yes.
They don't resolve the problem, unfortunately. This is not only for keratoconus, but also for dry eye patients. It's very important to tell them and to be honest with them that Scleral lenses will not resolve. It's not a healing device. It will help resolve the issues coming from these conditions. The issues with vision in keratoconus and the issues with discomfort in dry eye.
Yes. So moving forward to the third myths of our scleral lens. So ma'am, in India, there are many patients who has a fear of inserting this big lens in their eye. So whenever we as a practitioner try to introduce a scleral lens, they always tend to have that fear that how we are going to put this big size object in our eye. So ma'am, how to address this thing?
So I totally understand, and there has been different studies. There have been different studies on the difficulties in application of scleral lenses, and yes, we know that it's a bit difficult in the beginning. However, the study showed that there is no limitation of age, like 6 years old or 3 years old and 90 years old. They, with a good education on how to apply and remove the lenses, they learned how to do it with time. So it's very important to dedicate enough time for handling education for the patients. And also it's very important to understand which diameter is more appropriate for the patient. We have different diameters in scleral lenses. There is no only one diameter. We have small scleral lenses, larger scleral lenses. So for patients who have difficulties in applying larger lenses, we can switch to smaller lenses. And for those patients who never have applied any contact lens in their eyes, I will suggest before to do some training with soft contact lens. When they are comfortable with applying and removing the soft contact lens, then they can start with scleral lenses. It would be easier. And for patients who still have difficulties in application, we have so many devices that help in the application. So I don't know how many you have in India from these devices, but we also have different handmade. So patients do them by themselves. They don't have to buy them, and they are very easy and cheap also. So they can do them by themselves, like helping how to apply the lenses in their eyes.
Yes. So, ma'am, even while dispensing, I give major time while explaining the patient how to insert the lenses. So, I feel motivation is the key. And as you correctly said, ma'am, there are different plungers available with suction, without suction. So, with the help, it make little easier for them to wear. But the first barrier has to be, Not
only the plunger, but we have also devices that help the application, like the a teacup. If you put it upside down, you put a hole, then you will be able to use both hands to open the eyelids. Otherwise, you will have the plunger in one eye and only one hand to open the eyelids, which can be difficult. So having this cup will allow you to open the eyelids with both lenses. We have the rings also that you can put the Scleral with the ring, and this will help you to open the eyelids with both hands. So you open the lower eyelids with the middle finger, and with the index finger you open the upper eyelid. So we have so many devices that can be combined or not with plungers.
Yes, absolutely, ma'am. And as we have discussed in the one section, we will move forward to another myth that in India there is a lot of myth that contact lenses are harmful for our eyes. Like whenever we introduce the contact lens, they always have that feeling that this is going to cause infection in my eyes. This is not good for my eyes, and they always have that psychological thing that they are harmful for my eyes. So I guess we'll discuss some hygiene part of scleral lens also.
Oh, that's correct.
Yes.
A contact lens can harm the eye, but it's not the problem of the contact lens. It's the hygiene and compliance with our indications are the problem in causing the inflammation and infection in the eyes. So hygiene is very important. It's very important to clarify that no tap water used for contact lenses, no kind of contact lenses, so tap water should never be used, and the solution that we recommend should be used, and replacement of the case of the contact lens also is important. And talking about scleral lenses, the replacement of the plungers, every device that we are giving need to be replaced every time. The case should be replaced every time they open a new bottle, because they have a new case and the new bottle, so they have to replace it. The plunger, any device should be replaced at least every 3 months. And the solution that we are giving are proven to be safe for their eyes. So if they follow our indications and they keep hygiene and washing their hands before handling the contact lens, there is no risk.
Yes. So if you follow all the care and maintenance guidelines, then there is no point of getting any infection in your eyes.
Absolutely, yeah. Washing hands, no tap water, solution that we are giving, and replacement of case and the plunger. These are the main things to remember.
Perfect. And I guess here comes the last myth of our discussion would be that what is the normally patient think that scleral lenses are meant to be worn by an adult person. Like if we introduce a scleral lens to a pediatric patient suffering from some sort of irregular cornea, they always have that fear that this lens is not going to be handled by a kid, maybe 10-year-old or maybe even younger. So even this is biggest myth in India also.
Lenses are applied for newborn.
Yeah, actually.
There is no limitation of age. Again, I already cited the study about the range of application in scleral lenses. So there is no limitation of age, and we have many case reports in the literature. So it's not my opinion. We have them published in peer-reviewed literature that scleral lenses have been applied to babies, newborn, and to elderly people like 90 years old. There is no limitation. Again, so for babies and patients who have difficulties in applying scleral lenses, so patients also with special needs like Down syndrome or problem with their hands, the caregivers, the parents should be educated on how to apply and remove the lenses. And elderly patients also with tremor and they cannot apply the lens in their eyes. Also, in this case, caregivers should be educated in applying the scleral lenses. So there is no issue in handling. The people around them should be educated on them. For their eyes, there is no harm, even if they are babies or elderly patients. Scleral lenses are for everyone. So we talked about indication. There is no limitation for indications, high myopia or anything, but also scleral lenses are for all ages.
Perfect. And as we have seen that compliance is more in pediatric age group as compared to the adult age group, because pediatric patients tend to follow each and every step which has been
That's
instructed
correct.
to them. And
That's
adults
correct.
tend to forget some steps of maybe cleaning the lenses or washing their hands. So even I read that study also.
Yes, that's correct. There was a study on that, and they showed that the pediatric patients are more compliant than elderly patients.
Adult people.
Yes. Yeah.
Yes. Fantastic, ma'am. I guess we have covered some basic myths of the scleral lenses. And here comes the end of our video. And I just wanted to say a big thank you for your support, your guidance throughout my journey as a scleral lens practitioner. And your expertise has been really motivated me to do more better and serve my patients. So once again, a big thank you from India.
Oh, thank you for doing everything you can for your patient. This is amazing, and thank you for including me in your journey. Thank you so much, and it's my pleasure to be helpful for you and for your patients.